But for example, if you want to have like, for some reason, like, the Spiralo or IUD, you have to buy it yourself.
But the inserting is free. Or no? Sorry.
Yeah. Ano?
Asking.
I know, right?
Welcome to the Nosy Noisy Neighbors podcast with Chang
and Nin,
where two immigrants in Germany talk about expat stuff.
Hello again.
Hi.
So, since we've talked about getting sick, right?
Yeah, how to prevent.
Yeah,
how to
prevent, like-
preventive measure.
Eh,
No.
was it?
no. What do Germans do when they're sick?
Yeah, like what we've learned during our days here.
Yeah.
Days.
being
But yeah.
sick. Yeah.
Mm-hmm. True.
So now we are going to talk about how to maximize your Krankenversicherung.
That's true. Your German health insurance.
Yes. So first and foremost,
Yeah. Although this is not really an extensive discussion on maximizing your German health insurance.
it's just like basic.
But-
Maybe for some people that don't know.
That's true because for some reason, for example, for me, the first time I got enrolled in the public German health care, it was for me a little bit too how do you call it? I was scared to go to the doctors because I was like, then probably, it costs a lot because I was so used to paying out of pocket back home.
Yeah. Yeah, you told me that before that you thought that you have to pay.
Yeah, and it's like, and then I just go, when people tell you, just go there and bring your insurance
Your
card.
Yeah.
I was like, but that's so awkward, right? If you just go there and then afterwards you go home.
Yeah. So if you are like Chang, this episode is for you.
That's true. Don't be like me. Don't let your preconceptions, you call it that, right?
Yeah.
Yeah. Get the best out of you.
Or what you call that, be a hindrance
Yeah.
on getting your benefits.
That's true because you're paying for it. So if you don't feel well, especially if you don't feel well in any form, like physically, mentally,
Oh yeah.
or emotionally, perhaps,
Yeah, you can.
you can use the insurance to relieve that kind of how do you call it? Relieve this kind of issues.
Inconvenience.
Yes.
Minor
True.
or major
Yeah.
inconvenience in life.
Exactly.
Yeah.
So,
So you can, in Anspruch nehmen.
Yes. So
Yeah.
that.
So yeah, again, first of all, find an house arts.
That's the basic.
Very, very basic. Find your family doctor.
Mm.
Because before you can go to specialized doctor, they needed a shine or they needed this transfer
Yeah.
paper.
Recommendation.
Yeah, referral paper from your family doctor. So yeah.
True. So and for some areas or most areas, especially in big cities, it's quite difficult to find a doctor that's actually taking in new patients.
Oh yeah, because sometimes they are already full
Yeah.
or
They're just full.
they just they're just full. They cannot take
überfordert.
new patient anymore.
True. So you really have to go shopping. And by shopping, I mean,
Like hopping.
yeah,
Like you go clinic hopping, right?
like you call, you email, and sometimes even your doctor, like the first doctor that you've been to, is not the perfect doctor for you. Like, you don't feel very much welcome, or you don't feel like they're capable enough to handle your problem, your health
Yeah.
issues. So you can also check out other doctors. So perhaps Google Maps will help you.
What I did is I think I went to the clinic right there because if you email or if you call it's really different if it's face to face. You get an answer right away. It's quicker. So if they reject you, okay, move on to another clinic.
Yeah.
Well, I was just kind of like, I guess, lucky because my house arts is like walking distance by my house.
Oh yeah, that's true. Not everyone is as lucky as you.
Yeah.
Sometimes you have to go like far, like outside of the circle, like your circle.
Your
Yeah, yeah, like
nearby.
yeah, outside of that nearby area, just to find
House art.
house arts. And sometimes, like most of the time, like Google Maps like really helps. You have to check like if the doctor is
Like friendly.
especially if some would be like complaining like, yeah, they're only taking in like this people or that people, or they don't speak English, especially if you're
new.
or you're much comfortable speaking English with your doctor.
Yeah.
Yeah. So if you have like special needs, like person, like doctor who speaks English,
Yeah.
or things like that.
Or you think that this doctor is not friendly to Auslander,
Yeah, true. Or some people would actually prefer like a doctor who speaks Spanish because they're like doctors who are like
or
that.
Russian.
So yeah, that's also like some case. So you really have to search for it, like pre-search, yes, pre-filter the doctors around you. So yeah, anyway, going back to the health insurance system.
Like what Chang said, you don't need to bring money. You just have to present your card if you already have an house arts or like a family doctor. You don't need to give any cent.
Yeah.
Because it's like really covered. Like the basic, of course, right? Well, I think most like, it covers like broad benefits, like except the nature highlighted,
the homeopathy. Yeah, for some cases it's not covered. So yeah, like okay, like we're talking about the benefits.
Yeah.
Like as what we've read, insurance, like the health insurance here, like regardless of what health insurance, AOKA or Barmer or anything, they all have like the same or similar core benefits, right? So I think this also applies for private, but we're not
going to talk about like public only because
we're not very we don't have a lot of idea
and
with
experience with private.
when it comes to private. But yeah, so like the core benefit is because since we are all paying for this one, yeah, we have to emphasize on that. It's not free.
But it's not as expensive as like, getting healthcare, like for example in the Philippines.
True. So you have to, you get what you pay for,
Yeah.
I would say. Because there are people who who they refer to as voluntary members. Like for example, that's me. So some people pay, like half of it. Some people much less than half. Other people pay like the full or a portion of it. Depends on it's income based, especially for like for the public insurance, it's income based. Yes.
Like if you have a job, it's automatically that you
Deducted from-
deducted, and you don't pay for the full of that. 'Cause
Yeah, your employer
also,
pays a part of it, a portion of it.
yeah, it's like a regular, rente kind of thing.
So they take a portion like 20 or something.
Yeah.
And then from your pay, and then the rest they
Pay for that.
you.
Yeah.
Yeah, that's true. So going to the benefits.
That's a lot of introduction.
Yeah. So it includes like what Neen previously said, like going to the doctors, like for consultations, right? If you have like complaints, you go there and you don't have to bring money. Like this one, if you go to the doctors, if you do anything that involves like going to the doctors, and it's covered by your insurance, you don't have to shell out
Money.
money.
Not even a cent.
No.
Except if they give you a prescription, which is
Yeah,
you
that's
know,
that's already
that's-
outside of their
yeah.
like
But the thing is, like, just a quick,
Mhm.
you know, thingy, just a quick explanation with this prescripted medicine. Like,
Mhm.
it's also covered by your insurance. Like, it doesn't matter how expensive the medicine is. All you have to pay is €5, 5 to 10 euro. But
Mhm.
mostly it's 5.
Yeah. So no, it depends on the type of medicine, but yeah, minimum is 5, maximum is 10.
10, yeah.
Yeah. So that's what you call like the tsutalong.
Yeah.
Yes. So that's with the doctor. So for it includes like your general practitioner,
Mhm.
your specialist, like if you have like skin problem or I don't
Like, you know,
know,
if you want to go to OB.
mm, Frauen arts, or if you want to go to a psychology, psychiatrist, this one is like covered.
Yeah.
Except for some psychologists or like doctors or
Psychiatrist.
psychiatrists. Not all of them are covered. You really have to ask them if
Yeah, if they accept insurance. Because some of them, they only accept private. But yeah, also that, like, when I was like looking for like my house arts, I saw like some clinics, they only accept private.
So if you're searching for your doctor, any doctor, you really have to ask if they're accepting the public, like the public insurance.
Yeah.
So yeah. And like, other than consultations, you have to also, like, it also includes like, examinations, getting x-ray,
Yeah. Getting X-ray.
getting x-ray, and like other treatments.
Other tests like blood tests, like what did you say earlier? Like the Krebs, like the cancer.
The Forsorgo, like the Krebs Forsorgo,
Yeah.
like the
Cancer
prevention.
for cancer, right?
Mhm.
Like, yeah, for me, I had an allergy test and I already know that I have an allergy with what do you call this, with dust
With dust.
and cats. But and then I already know that before coming here. And then again I did the test here just so you know, because it was like 2 years ago and so maybe it changed, but I still have it. No?
So you're wishful thinking.
Yeah, I still have it then. And then my allergology, they gave me like a therapy. It's also part of that.
Oh, so see, like anything that, health related complaints,
Yeah.
most of the time they're covered by your insurance.
Yeah.
Yeah. And also like for really like big emergencies, like going to the hospital.
And confinement and admission, it's part of that.
Yeah. So if you need like inpatient, yes, you be inpatient care, then you can actually, that's also covered. Like even surgeries, right?
Yeah.
Mm-hmm.
It tells something about like, going to for your mental health.
Yeah, like for psych visit, like diagnostic. So if you need like diagnosis for, I don't know, depression or any other
If you're not
issues,
feeling well emotionally.
so you just usually what I did is I went to the
House arts. first.
house arts. No, I actually went directly to the Uniclinic. And then they said like, yeah, we need
The shine.
like the referral from your doctor. So I have to go back to my doctor, and then, discuss my issues and why I wanted to get the diagnosis. So they gave me the referral and I went back. And it took me 1 year
To get the termine
To
for
get the termine.
diagnosis.
for the diagnostic first. So I'm not yet sure if, if what's bothering me is actually,
A thing. If it's a real thing,
it's just
or it's
like in my
you.
mind. So I have
Wait,
to.
so you suffered 1 year
Yeah.
before waiting for the real so you can have a name for what you're feeling.
That's true. So I had to wait 1 year. And then you have to do the for me, I had to do the diagnostic. So that was like six appointment schedule, or 7 all in all. And then afterwards, I got the result, and
now you have a name.
and then I have a name for it. And they actually like give you a list of doctors to, you have a option. They gave you options like, oh yeah, here are the list of doctors you can go to for
Your therapy.
And then here's another list of doctors that you can go to for medicine. So they separate them. And
Well, because it's really separated. Like the psychiatrist is the one that's prescribing, like
Medicine.
medicine, and the other one is the one giving therapy.
so that's what I actually find actually good.
Like this is the point where you feel that you're really maximizing the benefits of your
That's
of
true.
your insurance.
Yeah, because they would be like, oh yeah, so what you're feeling is actually a thing.
Matter.
Yeah. So you go to this person, you contact this, and maybe they have a spot for you because they gave a long list, but they are all full.
So you have to call this list also.
Like you have to go doctor hopping again.
Yeah.
And then they're all full. But the thing is, what's good is they would still invite you for a get to know thing.
Yes, like building rapport.
Yeah, they just want to know if you how do you call that? Like if you have not a thing, but like
What?
wait, they just want to get to know you and check if your energy are like you have the same energy and you vibe.
It's vibe check.
Okay. So you do a vibe check with your
doctor.
therapist.
Yeah, it's building. Maybe you don't vibe, right? Like maybe you're not comfortable sharing your feelings with them.
Yeah. So they would actually like still invite you for that. And then, we would visit and they would try to fit you in.
Yes. So if you vibe with your doctor, they will find you a spot or something.
Yeah, that's what they would do for you. And
So it's not really depend. It doesn't really depend if they're full or not. It depends on the vibe.
perhaps because some of them would actually like straight away tell you like, no, we don't accept anymore. Or they would say like,
Let's
we're
see.
kind of full. We're kind of full. But if you have time on this day, you can come over for like get to know
Coffee drink.
how I wish there's coffee but they would actually offer coffee. But yeah, they would do that. And then you would sit and then
Talk.
have a small
That's
talk.
nice.
Yeah, they would not straight away like shoo you.
And then you did that.
Yeah, I did that. I found my doctor outside of the list that's given to me.
Oh, really?
Yeah, I found the doctor
On your
because
own.
no, I have to. When they say like no, we're full.
And then they gave another, doctor. You check this doctor or something. Like that.
Either they give you like recommendation or you follow up. Like maybe you recommend me someone.
Okay.
So yeah, that's another thing. Like we said previously that the doctors can be gaslight. They could gaslight you. So you have to insist. So this time you would also have to do like follow ups and things like that, regardless of how busy they can be. You just have to assert yourself.
Yeah.
Yeah. So yeah, I found my doctor. And then it was not also like, for example, they would ask you if you want something long term or short term. And
If you can't commit yet, if you're not ready for a
yes,
commitment.
that's true. So with your doctor. But then I would recommend though, like you do short term because if you, I don't know, probably a problem with commitment, but you would do short term because you can still like felengan. Like
Okay.
extend,
Yeah.
like re-extend your
your perbindo.
yeah. Like if you'd say like I want to do like a therapy, like a short-term therapy, and then if the doctor would say like yeah, that's good, and then you can ask because some doctors would be like, oh, okay, if it's short-term then it's short-term, but then you can ask like
because the therapy has like they would also suit their program to your wants and needs.
yeah. So you could say like I'm not yet very sure. I would like to check like how the therapy goes.
Yeah.
So something short term, and then maybe we can renew it afterwards if I need more. So that's what happened to me.
So yeah, that's thing like you can have like therapy here for free. Not really free because but
it's
it's
covered.
covered,
Yeah.
like it's not a hassle like in other countries. Like it's so expensive to have like mental healthcare.
That's true. Because you don't really have to shell money out from
From your
pocket. Just
like
have to bring your
your car. Yeah.
the usual.
And
So
then
yeah, other than going to the like psychiatrist, your general GP, there's also like for dental care.
I haven't actually tried that,
Mm.
but I think I should. But I'm not sure if cleaning is part, because somebody told me that cleaning teeth is not a thing.
Um, I do my cleaning back in the Philippines whenever
Same.
I can go back home. But for checkups, it's covered.
Check
Like
up.
X-ray, it's covered. For cleaning, it's partially covered. I actually inquired,
Mm-hmm.
and it's it's weird. It's unusual for me to hear the
The process.
the response, because they would say like it depends on the number of teeth that needs to be cleaned. Like you clean
that
the
even a
entire
thing?
mouth, right?
Is it even a thing?
I'm not sure because I asked for like the PAZ, the professional PCR, Zahnreinigung.
Okay.
So, and then they would say like it depends on how bad
How hard it is
to clean or something like that. And then I was like, okay, so they count per teeth. And
Okay.
I thought like, okay, it's not like, a whole a whole
Like, within our country, it's just like, okay, one session is like, let's say 700 pesos,
They would charge you like 1,000 maximum.
which it's like what you experience. Like my cat, my cats, they also did like a, tsariputsen.
Mm,
They didn't, like, the doctor didn't say like, and
per
how
teeth.
many teeth is
Yeah.
that.
Yeah, then maybe we should just go to the vet.
They will
Get
also
the-
sedate you,
Yeah. So, but yeah, like here for the cleaning, it depends on the number of teeth.
But I'm not sure, maybe with other dental clinic, maybe they do it like better. I'm not sure. But I haven't tried anything yet about the dental
Okay.
stuff here. Yeah, but I've read that like for some kids, sometimes it also covers if your teeth are really bad and you needed brace.
Like for kids, it's covered. Like until you reach 18.
Yeah.
Like if you go regularly to the doctor, there's some. I'm not sure if this is a thing. If you go to the doctor regularly as a child, you get like bonus. Is it a thing? Like like you go monthly and then
You get points.
kind of like is it
Yeah.
is it like points system? Yeah, just to you go to the dentist like regularly. Yeah, but after that, you have to go on your own. You have to be on your own.
No, if you're an adult already, like after 18, you have to work for your bonus points.
Yeah.
we talk about that. Yeah, but later.
Later. But yeah, like the Zahnreinigung, it's partially covered but not entirely.
Yes, Einzuschus.
Yeah, just like your how do you call that recept?
Yeah, but also I remember, I think also in the Philippines, like if you have private health insurance, I think also like teeth cleaning is sometimes it's also not included. Because I have brace before, and I wanted to have my teeth clean before, and then I have this private health insurance, and they have a list, and then I called them, and they said no, they don't take it.
Okay.
Maybe it's a universal thing.
I think because like dental care is not
Basic.
basic.
Is it not
I don't
basic?
know. Maybe because it's too expensive for the insurance to fully cover.
That's true. But maybe, like normal checkup, it says here also feeling.
Yeah.
It's covered. But
Because they're
cleaning
like
is not.
for emergency situations.
Yeah.
Kind of like, it's covered. But, cleaning your teeth, well, you brush your teeth every day, right?
It's your responsibility.
So,
Yeah.
and you do it like once a year.
Yeah.
So, I would say either you pay for it here, or if from where you're from, it's way
Yeah.
cheaper
Yeah.
than do it from home.
Anyway, so next, what else?
Yeah, we talked about prescription medicine.
Mhm.
And yeah, that being said, it's
worth
cheap.
it.
Yeah, especially if you have a lot of like maintenance as a person.
Maintenance. Okay.
Yeah. Like for example, you have, I don't know, diabetes.
Mhm.
Then this shit could get really
Expensive, yeah.
real quick. So that, or if you need Valium or
Value.
any other medicine that you
Value.
need, then it's covered. You pay €5 for it. But you have to have like,
The prescription, of
the
course.
legit prescription.
Oh, also, some doctors, they don't print the prescription anymore. Sometimes it is already uploaded in your card. So when you go to apoteke, you just
bring
have to
your-
present the card and they would just read it in their, I don't know, computer.
That's true. Probably because some people would just, use some other people's
Oh, yeah.
prescription.
Prescription, yeah.
So to be sure. And then preventative
Preventative care.
yes.
Such as
The checkups, we already talked about it. The
vaccination.
Vaccination.
Mhm.
Yeah.
So,
So
okay. So when I first found my house art, he asked me for my vaccine record since I was a baby.
yeah.
So it's like a tip. It's not like a tip. It is a tip if you're planning to stay here. Please bring all of your vaccine records since you are a baby or whatever, like any medical records that you have, because they will really ask you here. He said to me, like, I cannot cure you. I cannot go further with your checkup if I don't know which vaccines you have already. So because with my case, like, we got we got flooded. And so it was really all destroyed. So I really don't have any records of my vaccinations in the past. And then I told him that. And then I even Googled, like, during my infancy period, what are the
vaccines you needed.
vaccines that are required before, in the Philippines, that that you can get from the hospital or just like local clinics. I was able to find some, but it's not enough because I don't have proof, even if it's, verpflichtet at the time to get that.
But you're not sure if your mom really brought you to the clinic.
Yeah. So what we did is, like, I asked you about this, right? Like, he took some blood, like, blood testing, and then there he checked which vaccine do I have when I was a child, and then there he saw, and so I got this, like, those vaccines that I don't have. He put it on me. He injected it on me. No, he gave it to me, and then it's free.
Yeah. So that's true. I have the same experience. But here's another tip. Like, for vaccines, you can get it from your GP, from your doctor, or you can go to the Impfstelle. Like, you have this like vaccine center. So even
Like in our city, right? We have that.
So even when I went to the Impfstelle first before I even got like my house.
Really? You went to this first before to the house arts?
Yeah. So there we also did like the blood test, like, because they cannot. I brought my records, but then they were not really certain because it was just
Because in the
certificate.
Philippines, it's just like a small piece of paper and some, I don't know, like weird signature, and sometimes it's not even readable.
yeah.
So you don't know, they don't accept that here.
Yeah, or you could go to your local how do you call that? Like the health center, and then they would print out certificates, but then they were not certain because they were saying like, okay, there are different types of this vaccine, and then we're not sure like what kind. So that's why we also had to do the blood test. And but then for like, what was that?
Like the one with the big scar here.
Yeah.
Yeah, that is sure.
They would say like, okay, but this one we know what kind of vaccine this one. But still, just to make sure, we do the blood test. And for blood test, I'm not sure for your doctor, but for the Impfstelle, I had to pay out of
Oh yeah, blood testing.
pocket.
blood testing is not free for my
Okay.
case because it was done through a third party.
Mhm.
So I had to pay that third party.
Okay. Yeah. For me, same. But I had to pay directly in the Impstelo. I think back then it cost like 10 euros. So it's not that much.
With mine, it's expensive.
Okay.
Yeah.
Then
It is
probably
expensive, yeah.
because of inflation.
Oh yeah. Yeah.
So
I
it's an
don't know.
inflation thing.
But maybe because it's because with your case, it is partnered with Stadt,
Yeah.
with the city, so it's government kind of thing. With me, like the clinic is the partner of the third party, so
Yeah.
it is private to private kind of thing. So maybe it's expensive.
Probably that's also the case. And then every time I go for my for flu vaccine, I would just go to the Impstelo.
And
then
it's free.
it's free. You just have to show your
Insurance card.
yeah. So that's the good thing about vaccination.
Yeah, it is regulated here. Like unlike in our country, like whoever wants to have this vaccine
Then
can have it. It's not required.
that's true. Or sometimes you have to pay for the vaccine. Oh,
Yeah.
and one thing like travel vaccines.
Oh yeah. If you're going to like really really poor country, like for
Yeah.
example with malaria.
Yeah, like for certain areas where you have for like yellow fever, either vaccine or oral vaccine, these can be covered by your like the insurance. So you just have to ask your doctor.
Yeah, just say like I'm going to travel. I need this vaccine.
Yeah. And then they would say like this one's covered, this one's not.
Yeah.
So at least if you wanna travel, like for example, somewhere else outside Europe where for some reason it's not safe to go there without certain vaccine or they require you to have vaccines, then yeah, go to your doctor. So yeah. What else? What else are you
The OB.
yeah, for your gynecologist thing. They're covered for
Yeah.
sure. Like what's covered for the gynae is the Vorsorge, like Krebsvorsorge, and like your regular checkups.
Like if you're feeling if something is wrong with your reproductive system,
Yeah,
like you can just go in there and
I like ask for advice. Like even like the ultrasound, all sorts of ultrasound, it's covered by your insurance. You don't have to worry about you have to pay for this.
yeah,
But depends on what situation. If you just want because
just because
you have to pay for it.
there should be of course a reason.
Like if your doctor finds it like really required to
Yeah.
do that, then it's covered. And like for example, you want to have like vaccines we already to contraceptive planning
Oh
or
yeah. It is covered, right?
Um, there are certain things that are covered, but for example, if you want to have like, for some reason, like the spiralo or IUD, you have to buy it yourself.
But the inserting is free, or no? Sorry,
Yeah, I know.
I'm asking.
I know, right?
It's a genuine
Sorry,
question.
I understand. Well,
As far as you know,
as far as I know, the procedure is the procedure is covered, but there are some that you have to pay for, like the equipment used,
like the gloves.
the gloves and
And
then,
everything.
and
Okay.
things like that. You have to pay for it like extra.
Yeah.
It could cost like around 100 euros, but then it's like good for 5 years. So what's that for 100 euro? And yeah, and also
What else?
don't know. I don't know.
I don't go to the doctor that much.
Okay. So
I'm done with my doctor, appointment. Like I know, not really. Like I go now every week because of the I told you allergy therapy.
okay. Yeah, like if you have therapies. But then we've already talked about Salong, like extra payments on top.
We have to talk about like, bonus system.
True. Like
Yeah.
most insurance companies these days, they have like this bonus
Yeah.
program.
Like for example, in our insurance, like if you get 10,000 steps, you earn 50 cents.
That's true. Or if you go get vaccine, then you
They
earn
also get
more.
Yes.
Yes.
It's like your what do you advantage?
Advantage card, like SM Advantage. Or it's like your payback.
Yeah.
It's your payback or,
Or
your
you're
Deutschland.
earning miles.
Yeah, that's true. So it's like your miles, but for your
Insurance.
insurance. So yeah, like these covers, like walking,
Or you said like if you go to a fitness course.
or you buy your fitness watch.
Oh yeah. And also I'm not sure if it's a thing, but I read somewhere in Reddit that if you don't visit your doctor for like a year, you get bonus. Is it a thing? Have you heard about that? Yeah.
Okay, then probably for some insurance companies.
Yeah, for some I guess.
If you don't go to your doctor,
Yeah, if
how
you
about your
never have-
regular?
Well, because Germans love to do Durchhalten.
Okay.
So they don't visit their doctor. Like Martin, he never visit his doctor.
So you get the bonus.
Then with
Okay.
the-
You're with the wrong insurance company.
Yeah.
But yeah, like all of these things, so you have to like your receipts, you have to keep them or take a photo and then upload this on your app. And then, you get bonus. It's either you can convert it to cash or
Yes, redeemable.
which is good. So you can
It's not just some fake points that you earn.
True. And compared to like, your bonus points or your miles, this one's actually quite good because you can redeem it in cash or you can
You use it as your payment?
if you redeem it in cash, or you could convert it to something else, like I for example the AOKA, I'm still not I still don't understand how the other, like they would double your points if you don't redeem it in cash.
Okay, and then what can you redeem it with points?
AOKA plus, I think the AOKA plus. So if you go to a course, then I don't want to talk about that because it's
don't know.
confusing me. Maybe you could explain it to us
I
like
don't
for
know what you
5.
mean. Like,
Like this one. Yeah.
you can just ask him later.
Okay. Guthaben for plus Leistungen. I don't understand that. Anyway,
Say it again.
the Guthaben for plus Leistungen.
Okay. If
I
you
think
know,
this is just for AOKA plus.
yeah, if you are AOKA Plus, like insurance holder,
Yeah.
please comment down below and explain that.
it. Explain Ellie 5. Explain like I'm 5. So
Yeah, that's it.
maybe you wanna add more on how you maximize your
Insurance.
insurance here in Germany.
Yeah, that's it.
Oh, thank you for listening.
Bye.
Bye.